Did you know that our arteries need to be kept in good shape every day through different healthy techniques that can positively affect our lifestyle? Find out more below. Adopt a heart-healthy diet. Emphasize whole, unprocessed foods in your diet, including fruits, vegetables, whole grains, lean proteins such as poultry, fish, and legumes, and healthy fats like avocados, nuts, and olive oil. Reduce your intake of saturated fats, trans fats, cholesterol, and sodium. Choose leaner cuts of meat, opt for low-fat dairy products, and limit the consumption of processed and fried foods. Maintain a healthy weight. Strive for a healthy body weight by balancing calorie intake with physical activity. Excess weight, especially around the waistline, increases the risk of developing arterial disease. Incorporate portion control, mindful eating practices, and regular exercise into your routine to achieve and maintain a healthy weight. Engage in regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise every week. This can include activities like brisk walking, jogging, swimming, cycling, or playing a sport. Regular exercise improves blood flow, strengthens the heart, and helps to maintain healthy arteries. Quit smoking and avoid secondhand smoke. Smoking damages the lining of blood vessels, promotes the buildup of plaque, and increases the risk of blood clots. Quitting smoking is one of the most crucial steps you can take to improve arterial health. Additionally, avoid exposure to secondhand smoke, as it can also have detrimental effects on your arteries. Control blood pressure. High blood pressure, hypertension, puts strain on the arteries and can lead to their damage. Monitor your blood pressure regularly, and if it's elevated, follow a low-sodium diet, limit alcohol intake, exercise regularly, manage stress, and, if necessary, take prescribed medications to help control it. Manage cholesterol levels. High levels of LDL cholesterol, often referred to as bad cholesterol, contribute to the development of arterial plaque. Incorporate foods rich in soluble fiber, like oats and legumes, and omega-3 fatty acids, found in fatty fish, walnuts, and flax seeds, into your diet. Limit saturated and trans fats, and if lifestyle modifications aren't sufficient, discuss with your healthcare provider about cholesterol-lowering medications, such as statins. Control diabetes. If you have diabetes, it's important to manage your blood sugar levels effectively. Follow your healthcare provider's recommendations regarding diet, exercise, medications, and regular monitoring of blood glucose levels. Proper diabetes management reduces the risk of arterial damage and related complications. Reduce stress. Chronic stress can contribute to high blood pressure and inflammation, which are detrimental to arterial health. Find healthy ways to manage stress, such as practicing relaxation techniques, deep breathing, meditation, yoga, engaging in regular physical activity, pursuing hobbies, and maintaining a supportive social network. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure and contribute to the development of arterial disease. If you drink alcohol, do so in moderation. This means up to 1 drink per day for women and up to 2 drinks per day for men, with 1 drink defined as 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of distilled spirits. Get regular checkups. Visit your healthcare provider for regular checkups, screenings, and assessments of your overall cardiovascular health. They can monitor your blood pressure, cholesterol levels, and blood sugar levels, and provide personalized advice and treatment recommendations based on your specific needs and medical history. Increase fiber intake. Include a variety of fiber-rich foods in your diet, such as whole grains, legumes, fruits, and vegetables. Soluble fiber can help lower cholesterol levels by reducing its absorption in the intestines. Consume heart-healthy fats. Incorporate sources of unsaturated fats into your diet, such as avocados, nuts, seeds, and olive oil. These fats can help lower LDL cholesterol levels and reduce inflammation in the arteries. Eat fatty fish. Include fatty fish like salmon, mackerel, and sardines in your diet at least twice a week. They are rich in omega-3 fatty acids, which have been shown to reduce inflammation and lower the risk of heart disease. Limit processed and sugary foods. Reduce your consumption of processed foods high in refined carbohydrates and added sugars. These foods can contribute to weight gain, insulin resistance, and inflammation, increasing the risk of arterial damage. Control portion sizes. Be mindful of portion sizes to avoid overeating. Use smaller plates, listen to your body's hunger and fullness cues, and avoid eating in front of screens or while distracted. Stay hydrated. Drink an adequate amount of water daily to maintain optimal hydration. Proper hydration helps maintain blood volume and promotes healthy blood flow. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Inadequate sleep has been associated with an increased risk of high blood pressure, obesity, and diabetes, which can all negatively impact arterial health. Manage chronic conditions. If you have existing medical conditions such as high blood pressure, high cholesterol, or diabetes, work closely with your healthcare provider to effectively manage them. Follow their recommendations, take prescribed medications as directed, and attend regular checkups. Limit sodium intake. Reduce your consumption of high-sodium foods like processed meats, canned soups, and fast food. Excess sodium can contribute to high blood pressure and arterial damage. Aim for no more than 2,300 milligrams of sodium per day, or even less if you have hypertension. Stay active throughout the day. In addition to structured exercise, incorporate more movement into your daily routine. Take breaks from prolonged sitting, go for short walks, use stairs instead of elevators when possible, and engage in activities that promote circulation. Manage stress effectively. Chronic stress can contribute to arterial damage. Find stress-reducing techniques that work for you, such as deep breathing exercises, meditation, yoga, mindfulness practices, or engaging in hobbies and activities you enjoy. Limit processed meat and red meat consumption. Processed meats like sausages, hot dogs, and deli meats often contain high levels of sodium, unhealthy fats, and preservatives. Red meat should be consumed in moderation as it has been associated with an increased risk of heart disease. Opt for leaner protein sources like poultry, fish, legumes, and plant-based proteins more frequently. Incorporate antioxidant-rich foods. Antioxidants help reduce inflammation and oxidative stress in the body, which can be beneficial for arterial health. Include foods like berries, citrus fruits, leafy greens, cruciferous vegetables, and colorful fruits and vegetables in your diet. Consider natural supplements. Certain supplements have shown promise in supporting arterial health, but it's important to consult with your healthcare provider before starting any new supplements. Omega-3 fatty acids, coenzyme Q10, CoQ10, garlic, and green tea extract are some examples that may have potential benefits. Practice good oral hygiene. Poor oral health, including gum disease, has been associated with an increased risk of heart disease. Brush your teeth at least twice a day, floss regularly, and visit your dentist for routine checkups and cleanings. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure, contribute to the development of arterial disease, and increase the risk of other health problems. If you choose to drink, do so in moderation, or consider abstaining altogether. Stay hydrated with water. Adequate hydration is essential for overall health, including arterial health. Drink plenty of water throughout the day to help maintain optimal blood viscosity and support proper circulation. Limit caffeine intake. While moderate caffeine consumption is generally considered safe, excessive intake can lead to elevated blood pressure and increased heart rate. Be mindful of your caffeine intake from coffee, tea, energy drinks, and other sources. Include dark chocolate. Dark chocolate with a high cocoa content, 70% or more, contains flavonoids that may have positive effects on arterial health. Enjoy a small portion of dark chocolate as an occasional treat, but be mindful of added sugars and portion sizes. If you think that there were still more aspects to mention, tell us in our comments box below and we will gladly read you.